Good evening, everyone, and thank you so much for joining us tonight. Before we get started, I would like to read the brief disclaimer that you can see on your screen now. And the disclaimer says this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to say welcome again. Thank you so much for spending your evening with us tonight. My name is Craig Orpello, and I will be your host tonight. And for anyone out there who did celebrate this weekend, we do want to wish you a very happy holiday weekend. Welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. As always, the PharmAssist program takes place every Monday at 7 p.m. EDT. Tonight, we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, whether in the chat or directly into the Q&A. So as always, we are joined by various amazing HCPs each week from across the nation to provide you with the real-world experience, just as if you were actually sitting in their clinic right across the table from them. And today we are joined by Laurel Meier. So I want to thank you so much for your time and your interest this evening. And now I would like to turn it over to Laurel. Take it away, Laurel.
All right, thanks, Craig. My name is Laurel Meier. I'm an IVF case manager in California. And tonight we're going to be going over 3 medications: Progesterone and Oil, Estrogen, and the Hcg Trigger Shot. So if you're taking any of these medications in your IVF cycle, then this is a good night for you to be watching. So there'll be a Q&A after each video, and I encourage you to put in your questions, because any question you have, someone else will have it too, and they will benefit definitely. So focus your questions on the way the medication works, the side effects, and focus your clinical questions specifically like on timing and dosages for your specific schedule back to your IVF case manager. So these videos are always available, tonight's included, at mymandelsPharmacy.com website, on Facebook, and on the YouTube channel for My Mandels. So to get started, I'd like to share a story of how I became interested in becoming an IVF case manager. About 25 years ago, my husband and I started having trouble getting pregnant. We went through several rounds of Clomid and did not have success. So some of you may have done Clomid. It's not fun, but didn't work for us. So then we went on to IVF. We did several rounds of IVF, again, without success. And while we were still just reeling from the bad news of the last cycle not working, we got a call from a friend who was a labor and delivery nurse. She had just had a patient who delivered a baby, and she wanted to find parents for her baby. She was not ready to be a parent herself. So my friend told her about my husband and I, and she wanted to meet us. So we rushed down to the hospital. We met her, and she decided she wanted us to be her baby's parents. So the next day, we brought our little girl home, and it just so happens it was Valentine's Day. So fast forward 4 years, we wanted to expand our family, and we had been on a waiting list for using an embryo that had been donated to the clinic. So it's sort of like an adopted embryo. We were the recipients of this embryo, went through a frozen embryo transfer cycle, and I got pregnant. And that second little baby girl, she was born on the 4th of July. So now we have 2 holiday babies, and here they are all grown up. This was a long time ago. So that's Sydney and Megan. So neither of our daughters are genetically related to us, and we kind of like that they have that in common, though that's not necessary, of course, but it's kind of nice for them. And the reason that I share this story is because I've been through IVF and I know what it's like. I know about the ups and downs, and I know how hard it is and how hard it is not to know how your journey is going to turn out. But I want you to keep the faith and reach out. You're not alone. There's thousands of people going through IVF right now, through infertility procedures, and I want you to reach out and talk to friends and family and other couples going through IVF, because that can really help you have faith in your own journey. It really did for me. I reached out and it was very, very good for me in the process. So just keep the faith, stay positive. You will get through this and you will build your family. So this was a very quick version that I just told you on my fertility story. If you would like to, my long version has a lot more ups and downs to it. And if you would like to watch that full version with all its gory and glorious details, you can. And you can go to mymandels.com and look for Behind the Shots. Click on that tab and find Laurel's story, and you can watch it there. So tonight, my goal is to help you become familiar with how to draw up and give these medications. And hopefully, very soon, you will feel like a pro. So let's get started. Craig, if you can start the first video, it's on progesterone in oil. Hi, everyone. My name is Laurel Meier. And today I'm going to share with you how to draw up and inject the progesterone in oil. This is a picture of an example. It is made by different manufacturers, so your vial might not look just like this one, but it does always come in 500 milligrams per 10 milliliters, which is the same as 50 milligrams per ml. It's a 10 ml vial, and the typical dose is 1 milliliter per day. So the vial has 10 doses or 10 days worth. The common bases are sesame oil and ethyl oleate, although it does come with some different bases. These are the most common. The progesterone in oil is used in a FET or frozen embryo transfer cycle to change the receptivity of the uterine lining and prepare it for the embryo transfer, and then maintain the uterine lining after the transfer to keep that uterine lining in a good, nice place for the embryo to grow. So next we're going to go over the IM injection sites. There are 2 sites that we typically use. On the left here is the ventrogluteal muscle. And with this site, you do need to aspirate, and we'll talk about that in a few minutes. The ventrogluteal muscle is the ideal site. It is a larger muscle. There are no vessels or nerves that are large enough to puncture or to damage, and there's no aspiration needed. So this is really the ideal site for the IM injection. We are going to go over how to find these, and you can see by the picture that if your partner is finding the ventrogluteal site for you, they'll find the hip bone on the side of your body, put their fingers just below the hip bone and spread the fingers apart. And that triangle is the area of injection. If you're trying to find the site yourself, I want you right now to find your hip bone on the side of your body, feel for your hip bone, and then slide your fingers down about 2 inches below the hip bone. This is the ventrogluteal muscle. Then if you slide your fingers back from the ventrogluteal muscle about 2 to 3 inches, this is the dorsogluteal muscle, straight back from there. So that's how you can find the site yourself. So now I'm going to show you how to draw up the progesterone in oil and give it yourself. So the first thing you're going to do is collect all your supplies. You need a 3 ml syringe with a needle attached. When you take it out of the paper, you'll just need to make sure it's twisted on all the way. The reason why these are not twisted on all the way is because with the sterilization, they have to have them a little bit loose. So twist it on, open up your other needle, which is for giving your progesterone. Open up your progesterone and oil, and then you have your alcohol wipe. Always alcohol the top of your progesterone before you get started. Make sure you've washed your hands and that you've dried them thoroughly. And then you're going to draw up the amount of air equivalent to your dose. And I'm milliliter as an example. So take off your cap, inject the needle into the circle in the top, turn everything upside down, and then you want to make sure that you can see the tip of the needle in the oil. Push the air in and pull back and let that oil drip down the side. It can take a little while, so just be patient with it. You can see that it's dripping down the side. And the thinner the needle, the longer it takes to draw it up. So if they give you a large bore needle, you can go ahead and use that because it'll make it a lot faster to draw it up. But whatever they give you that's already attached to the syringe is the one you're going to be drawing it up with. So keep going until you're a little past the one line. And you do have to be patient with this one. And then push out. And if you see little teeny bubbles, you can ignore them, but any large bubbles, you're going to want to get rid of. And you push right to the one line so that the black line is on the one line. Turn it back up, right side up. Take the needle out. And you want to recap with a one-handed technique. So you take the cap on the counter and you just scoop it up and click. Now you're going to switch over to the give needle. So you twist it off, twist on your other needle. Now you're ready to give the shot. Now to prepare to receive the shot, you need to have your muscle as relaxed as possible. So what you want to do, my suggestion is just to lay on a bed on your side, and your partner can sit on the bed next to you to give you your shot. Another option is if you'd like to stand, you can stand at a counter using the counter as like a balance point. You want to put all of your weight on the opposite leg from the side you're receiving your shot. You can keep your toe on the ground just for balance, and your partner can sit in a chair next to you and give your shot that way. Also, if you're giving your shot yourself, I would use the standing technique. You've got the counter for stability, and you can use your dominant hand to give it in the dominant side. Just to get started, you'll definitely want to do that. All right, so let's get started with the actual injection. Another thing I wanted to discuss is ways to make this shot less painful. It looks pretty intimidating. It's not as painful as you think it would be, but there are ways to make it completely painless. You can either get EMLA cream or a numbing cream or a numbing patch. That works really well. You can use ice on the site for 30 to 60 seconds. Just ice your skin. And another really nifty technique is a tickle technique. That's what I call it. And what that is tickling the skin next to the site while you're injecting. And what that does is it takes advantage of the gate theory, the gate nerve theory, by distracting your skin into not feeling the poke. So it's really nifty and it works pretty darn well. So using one of those techniques, I'll use the tickle technique just to show you how it works. Take off your, before I take that off, I'm going to alcohol my skin a little bit and let it dry. And then you're going to give your shot. The tickle technique is just a little bit of tickling, and then you go straight in like a dart. Now, if you're in the dorsal gluteal site, which is the upper outer quadrant of the buttocks in the back, you're going to want to aspirate. And what that is pulling back on the plunger and looking for blood return. You're not going to pull real hard, but you're going to pull a little bit and look to see if blood comes into the syringe. It's very rare, but if the blood does come into the syringe, it means that the tip of the needle, which would be way down here in the muscle, is lodged directly in a blood vessel. And we don't want to give the medication into a blood vessel. So what you would need to do at that point is pull out, change to a new needle, and give the shot in a different site. If you use the side of your hip or the ventrogluteal site, you can skip that step completely, okay? So you'd go in like a dart, you'd inject, and it's going to take a little bit of time, so just push fairly hard. It's a skinny needle, and you've got a thick oil base. Once it's already injected, wait about a minute, 30 seconds, and then pull straight out with pressure. This will go in the sharps container, and you're just going to hold for about a minute. Keep the weight off of your muscle, off your leg, and then check. The partner's going to check the site. If it's bleeding or there's medicine leaking out, they'll continue to hold it. And if it's dry, then you're done. No Band-Aid needed. And that's all there is to it. All right. Any questions come in about that?
All right, let's see. So we do have some questions coming in, Laurel. So let's see. First off, okay, so just a reminder for everybody again. So as your questions are, you're thinking of questions about this, remember as we will try to answer every single question that you put out there. Some we may preface, as Laurel mentioned before, that we may have to say also refer back to your clinic. But we will try to at least provide an overview answer as much as we possibly can. So feel free to send any and all questions. And again, remember, into the Q&A or in the chat if you're joining us on Zoom, or directly just into the chat if you're on Facebook, just like this question that comes in. And so this one comes in, you know, pretty much every single time on almost every product. People want to know kind of why am I on these different products? So just generally, why am I being prescribed progesterone and oil? And the second half of it, which is a little bit different, is why would I use this presentation of progesterone rather than pills or, say, suppositories? Okay.
All right. So I touched on why progesterone is used in the video. It maintains the uterine lining. So it's a nice, warm, comfy environment for the embryo to grow. And it needs to be kept going for several weeks, either about 10 to 12 weeks, until the placenta takes over, gets large enough and takes over and produces enough progesterone so you don't need the supplemental progesterone. So it is a long haul medication. You want to give it, switch sides, left, right, every day, and your hips can get sore. So the presentation, so intramuscular progesterone and oil. It's important to know that they have done a lot of studies with different types of progesterones. They've studied ongoing pregnancy rates, and they found that the pill, the oral pill, just doesn't work. It doesn't get your progesterone levels high enough. And it causes a lot of side effects when you take it orally. So then we've got suppositories, and they've done studies to compare progesterone and oil and suppositories, and some studies have found that they're equivalent and they have the same ongoing pregnancy rates, and some studies have shown that progesterone oil is superior to endometrium or other types of vaginal preparations. So they both work. I think most clinics these days are sticking with the progesterone and oil shots because they are the gold standard, but there are indications where the endometrium or crinone would be useful. And if your clinic says that that's what they'd like you to take, then trust them on that. There are also ways to switch over from the intramuscular progesterone over to the suppositories after you're pregnant, after you've had your prenatal ultrasound and you can see a heartbeat. So if your hips are getting super sore and you want to switch over to the other suppository type progesterone, you can ask your clinic about that. So I think that answers that. Next question.
Thank you very much. No, that's a great answer. And I think sometimes people want to get a little bit more information on why they're on something, but also, as you mentioned, a lot of these products, they are similar sounding products or similar, products, but different presentations. And so that's a great question to ask. And that's really the point of PharmAssist, is ask these types of questions here so that you can feel comfortable. And sometimes it may prompt you, as Laurel mentioned, to ask a great question next time you go into your clinic yourself. So it kind of gives you a little bit more information. Sometimes we don't like to ask questions because we feel like we don't have all the information and we don't want to look like we don't know what we're asking. So that's a great place, again, for PharmAssist to get the information that you need to get the good baseline of comfort So then you can go back in and talk to your nurse or your physician and feel a little bit more confident and comfortable. So thank you so much, Laurel. That was an excellent answer. And we are ready. Let's see with the next question. So it says, and this is just a little bit about the way that we inject this medication. And we know with this one specifically being intramuscular, a lot of times these types of questions come up. And so it says, can you explain a bit more about why some medications are regular subcutaneous injections and why others need to be intramuscular? So maybe just a little bit more elaboration on the difference between those two and why you do one versus the other.
Sure, yeah. Good question. So a lot of IVF medications are subcutaneous. They're into the fatty tissue. But some do need to be given intramuscularly. And there's a few reasons why things need to be given intramuscularly. One would be an oil-based medication. The muscle has more vasculature. It absorbs medication faster. And an oily medication doesn't absorb as well as a water-based medication. So you want to give that into the muscle. Hence, progesterone oil has to be intramuscular. Another reason would be if the medication is really irritating to the subcutaneous tissue, you would want to give it intramuscularly. Or if you need it to absorb super fast. And for those of you who've had your COVID shot, it has to be given intramuscularly because it absorbs fast. And that's what they want, is we want it to get into the bloodstream really quickly so it can do its job and trigger your immune system.
Perfect. All right. Thank you very much. Great answer. And keep those questions coming. So let's see, we have some more coming in. Okay, how about this one? What are some of the biggest side effects that you have seen associated with progesterone and oil, and just things that I should be looking out for?
Okay, yeah, progesterone and oil does cause some common side effects. Breast tenderness, headache, and fatigue are the three biggest, I would say. You also are going to have some soreness at the injection sites, of course. And you may experience nausea, and you may experience some moodiness. So those are the main side effects that I see in my clinic.
Perfect. All right. Let's see. We have some others coming in. So, all right, you touched a little bit on this in the video. So I just an opportunity to maybe elaborate a bit more about the different locations that somebody would inject and how they would do so. And so somebody here has a question saying, so this product's brand new to me. So some additional information would be helpful and appreciated. Do you recommend that I have my partner inject my progesterone and oil, or should I inject it myself? Because you touched on both of those different methods. And also the second part of that is, do you recommend injecting standing up or laying down? Thank you so much.
Okay. Yeah, so those are all options. I like to recommend that your partner give you your progesterone and oil because that is a long needle. And for me, that would be very intimidating to give myself that shot. So if I had the option of having a partner give it, I would definitely take them up on it. And I think that laying down with your on your side, with your partner sitting on the bed next to you, is kind of a nice, relaxing way to do it. So that would be my recommendation. So if you need to give it yourself, however, I think the standing technique works the best. You can stand in the bathroom, hands on the counter, just for a little stability. Put all your weight on the opposite side from the side you're going to get the shot, and then put your toe on the ground on that side without the weight. And then you can easily take your dominant hand and give the shot. Just mind over matter. You just gotta do it. So the first time's the hardest. Just know that if you use some of those techniques we talked about, the Tickle Technique is a little hard to do on yourself, but you can manage. Icing it using Emla cream or Sonera patch, those are all helpful. And then another thing I would recommend with giving yourself the injection or your partner giving it is drawing a circle in the area where you're going to give it before. And this just makes you feel better because you know you're going to give it in the right spot if you have a circle drawn ahead of time. Okay.
That's great. And I think one of the things that people tend to, sometimes if you're only thinking about the negative or you're nervous, and a lot of times people will be nervous the first time, but one of the things with this being a medication that you're going to be taking for a period of time is that first one, you can get it all out, all the jitters and the nerves of kind of getting ready for it before that first time, and then you'll be a pro. And so it's not like this is, it's one time only and I have to nail it right on this one time. If I mess up, this is the big payoff shot. No, you have your opportunities to get comfortable with it by that first shot. So then by the end, you will be an absolute pro. And by your second shot, it won't even be a problem. So thank you so much, Laurel. I really think sometimes we tend to focus on some of the things that they just get in our brain, and they get in there and you start to get a little bit nervous and you don't think about the positive side. So you really were able to help, I think, put people at ease in a way that, that's what we're trying to do here. So thank you so much. And with that being said, it does look like we are caught up with questions right now. As always, we like to give people a little bit more time. So if you are just thinking of a question, or if that answer just sparked another question in your head, feel free to get it into the chat so that we can answer it. We always do remind everyone that once we move on, that's not the end of the game for your progesterone and oil. You can ask about that all night long throughout the course of the program. So we'll have plenty of time to get to that. But in the meantime, let's give another, let's say 30 seconds or so, and I will throw it back over to you, Laurel, if there's anything else you want to share about that, just in case, as we wait to see if we get any more questions, and then we'll move on to product number 2 tonight.
Okay. So progesterone and oil is something that you are going to feel a little bit intimidated at first. But as Craig said, you'll get used to it the more you do it. And it is something that you do every day. And it doesn't hurt nearly as much as you think it's going to. So it's more in your head about the fear of it than the actual pain of it. So I encourage you to get through that and you will become a pro. So our next medication is Estrogen, or also another name for that is Estradiol Valarate. It's given for frozen embryo transfer cycles in order to build your lining. So Craig, if you'd like to start that video, that would be great. Hi everyone, my name is Laurel Meier, and today I'm going to show you how to draw up and give your Estrogen. This medication is made by different manufacturers, and you can see by this slide that the vial can look differently depending on who makes it. It does come in 3 strengths, 10, 20, and 40 milligrams per ml. And the reason why I mention this is it's really important to check your vial and see what strength you have, and then let your clinic know what strength it is, and they can tell you how much to take. As an example, a typical dose is 4.8 milligrams twice a week intramuscularly. So if your strength is 10 milligrams per ml, you would give 0.48 milliliters. As the dosage, or as the medication gets stronger, you give less. So with 20 milligrams, it'd be 0.24, and with 40 milligrams, it would be 0.12. And I'll show you how to find that on the syringe. So the main thing is just to make sure you check with your clinic, tell them what strength you have, and they'll tell you what dose to take and how often. Now, Estrogen is used to thicken the lining. It's typically used in a frozen embryo transfer cycle, and it thickens the lining so that it becomes a nice home for the embryo. We're going to talk about now where to give that shot. And there's 2 IM injection sites. There's one called the dorsogluteal muscle. This is the upper outer quadrant of the buttocks. If you put an X on your buttock cheek, it is the upper outer section. This site, you do need to aspirate, and we'll talk about what that is in a few minutes. The other site, the ventrogluteal muscle, is on the side of the body. And to find this site, I want everyone watching to find your hip bone, slide your fingers about 2 inches below the hip bone, right on the side of your body. And this is the ventrogluteal muscle. Slide your fingers 2 to 3 inches straight back from that site. This is the dorsogluteal muscle. Now, if your partner is finding the site for you, they can do as the picture is showing, find your hip bone, put their fingers under the hip bone and spread the pointer and middle fingers apart to form a V, and this is the site. So this is the ideal site for several reasons. The ventrogluteal muscle is much bigger than the dorsal glute. It does not have any nerves or vessels that are large enough to puncture or to damage in any way. So this is considered the perfect site for an IM shot. It also can handle that shot that's given repeatedly for over several weeks, like the Estrogen is. So the next thing we're going to do is to draw up the medication. We are going to gather our supplies. You're going to need your medication, your 2 needles, one for drawing up and one for giving. And you'll want to look at them and you'll want to see there's one that's thicker that you're going to draw up with and one that's thinner that you're going to want to give it with. There's your 1 milliliter syringe and your alcohol wipe and a Kleenex. Okay, you want to have all these supplies ready. You want to wash your hands first, of course. First thing you'll do is take your cap off, alcohol the top of your medication. You want to do this every time. And then you get out your syringe and your 2 needles. You'll put the skinny one just on the table, and you'll get your thicker one and you'll put it on the syringe. So twist it on like that. And you're ready to draw up. Now, I'm going to use 0.24 as an example because this is typical. 0.24 is, if you look at your syringe, you find the 0.2 line and you count 4 little lines past it and you put that amount of air in if that is your dose. So whatever your dose is, that's the amount of air you're going to put in your syringe. Take off your cap, put the needle in the circle in the very middle and turn everything upside down. You're going to pull back a little, making sure that the tip of the needle is in the oil. Push your air in and then draw back and it will start to drip slowly down the side. And this is one of those times that you have to be patient because it will drip pretty darn slow. And as you can see, it's just drip, 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 sliding down the side. And you want a little more than your dose, and then you can push the air out. And you want the black line to end up right at your dose. So I'm going to go to the 0.2 plus 4 little lines, like that. Now you turn everything back up, right side up, pull your needle out, and then with a one-handed technique, you want to recap. The best way to do that is just to put the cap on the counter and slide the needle in like that and click it on. Now you switch to the give needle. And now you're ready to give the shot. So a couple helpful hints on how to make this shot less painful. You can choose to purchase a numbing cream or a numbing patch. Sonera is a numbing patch you can use. And if you use either of these, you won't feel the poke at all. You can choose to ice the site for about 60 seconds beforehand. That can help. And another nifty technique is the tickle technique. That's what I call it. So what this is tickling the skin next to where you're going to give the shot on either side as you're going in with the needle. And this takes advantage of what's called the gate nerve theory. And it will actually trick the skin into not feeling the poke. And it works very, very well. So what you're going to do is pick your site, and you want the muscle to be completely relaxed. So in order to do this, I would recommend just lying on your side on a bed with your partner next to you. That's going to give you your shot. Or if you prefer to stand, you can stand with all of your weight on the opposite leg from the side you're going to receive the shot. So I would have a counter handy just for balance and put your toe on the ground for stability. And your partner can sit in a chair next to you. Or if you have to give the shot yourself, I recommend the same standing technique. Put all your weight on the opposite side from the side you're going to give it. And I would give it on the dominant side with your dominant hand. So if you're right-handed, it'd be the right hip. So
With that in mind, now to give the shot, the tickle technique, tickle, 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 and you're going to go straight in like a dart at a 90-degree angle. If you use the dorsal gluteal or the upper outer quadrant of the buttocks site, then you'll need to aspirate. And what that is pulling back on the plunger and looking for blood return. The reason you do this, although it is very rare, sometimes the tip of the needle can go directly into a vessel. And if the tip is in the vessel, you're going to pull back and see blood that comes into the syringe. If that happens, you're going to want to pull this out, switch the needle to a new needle, and go to a new site and give the shot. And it's okay to give the blood, the medication with the blood mixed in back to you because it's your blood and it won't hurt you. But if you use the ventrogluteal site, you can skip that step. So you go in, you just go ahead and give the medication. Once it's all the way in, wait about 3 seconds, pull out, and have a Kleenex handy to hold the site firmly. You want to keep your muscle relaxed this whole time. And then after about a minute, your partner's going to check the site. If there's any blood or medicine leaking out, you'll continue to hold the site until it's dry. Check it again, it's dry, you're all done. Everything will go in the sharps container. And then this will go back in the cupboard. You don't want to put this in the refrigerator, and that's all there is to it.
Okay, so you got a lot of duplicate information tonight because these were both intramuscular shots. But if anyone has any questions about Estrogen, I'd be happy to answer them. Did any questions come in, Craig?
Yes. All right. So the first question says, why do I need 2 needles, both the pink and the black, with the Estrogen? Do I need to use both? Is there something that I am missing?
Good question. Okay. So I do have a sample of the pink one, and this is ordered by some clinics. We typically don't order it, but this pink one is an 18 gauge. And as you can see, it's pretty darn thick, right? Now it makes it super easy to draw up the medication with something that thick. You wouldn't want to give the medication with that, but it doesn't make it easy to draw up. Switching over to a small needle, you're obviously going to want to give it with a smaller gray needle like this one. Now, in our clinic, and it's really, you should follow the directions of your clinic, but in our clinic, we do say it's okay if you want to draw it up and give it with the same needle. So if you had the gray needle, you could just draw it up with that same needle and give it with the same needle. If you're to draw it up with the pink one, it's a pretty thick needle. And if you're going to puncture through this many times, which you will have to many times, it's going to cause a lot of leakage. You're also going to lose a lot of medication in the actual needle and the hub of the needle each time you give it. So there is some waste there. So with the messiness of that and the waste, I would recommend not doing the switching over, but it's really up to you, and you should follow your guidance of your clinic.
Perfect. All right. Thank you for clearing that up, because I know that's a bit of a clinic preference. And so again, this is one of those things, just to reiterate, that obviously depending on what your clinic chooses to do, but if this is something that you can have a conversation with your clinic, you can obviously find out, if it is they definitively want to do one way or the other, or if it's something that, you can have a conversation with. So thank you for providing the information and a bit of the information on both sides of the aisle there. All right, let's see. Some more questions coming in. Says, okay, a friend of mine used a Estrogen patch rather than an injection. Why would I be prescribed one versus the other? So another kind of presentation question like we had before.
Right, yeah. A Estrogen or an estrogen patch. There's also the brand Climera. That's also an estrogen patch. Can be used in place of Estrogen shots. There are advantages and disadvantages to both. Obviously, if you're wearing a patch, it's something that you can avoid the shots, which is really nice. But there are disadvantages to the patch. You replace it once a week, typically. However, many patients will find that it starts to peel off before a week is up, and they end up needing to replace it early. So that's one disadvantage. And then another would be sometimes the lining just doesn't build up as thick as it should when you use the patch. So a lot of times the patch is combined with oral estrogen, and that can help the lining build up to the appropriate thickness so that you can have your transfer. So I would just go with what your clinic says. Each patient is a little bit different. And there are also provider preferences. So they're going to give you what they think is best for you.
Great. Thank you so much. All right. So this one's just a little bit more for elaboration, but as always, we typically get questions about just why different medications, why we're on different things. And so you did touch on this a little bit, but the question is here saying, I was prescribed a number of different meds, and I'd like to know why estrogen is one of them. What exactly does it do? Can you elaborate? And what part does it play in an actual normal cycle, not mine where I need to add it?
Right. Okay. So in a normal menstrual cycle, estrogen is produced by your body in response to pregnancy, so that you're going to create enough estrogen on your own to maintain the lining. It also builds up while you're, I'm not answering this very well, but in a natural cycle, you have plenty of estrogen to build up the lining to an appropriate thickness for the embryo to implant. However, with a frozen embryo transfer cycle, obviously you don't. You are suppressing the ovaries. They're not producing the estrogen that you need. So you need to take it as a supplement. So that's why. Craig, can you give me the rest of that question?
Second is just, what does it do as it's like, we're taking the medication?
Yes.
Cycle that like,
I don't know.
Cycle, how does it actually work that way?
So when you take it for an FET cycle, it does thicken the lining, and that's its purpose, thicken and maintain the lining. Back to you, Craig.
Perfect. Sounds good. So it does look like we are caught up with the questions for right now. So as before, let's give another 30 seconds or so. I will throw it back over to you if there's anything else you wanted to share, whether about estrogen or progesterone and oil, anything we've spoken about so far. And if there are no questions at the end of that, we'll be ready to move on to our third and final product of the evening.
Okay. All right. Well, nobody really asked about the side effects of estrogen. Just want to mention, again, they're similar to the progesterone in a way. They do cause some fatigue and irritability, and you can have some soreness at the injection site, yet not nearly as much as the progesterone oil, because it's a much smaller volume that you're injecting, and only twice a week. So just wanted to tell you that, and then we can go on to the last one, which is the Hcg Trigger Shot.
Hi, my name is Laurel, and today I'm going to be showing you how to mix and give your Hcg Trigger Shot. Hcg comes in 10,000 or 5,000 units, and your clinic will tell you how much to give. It typically will come in 10,000, and that's what I'm going to show you today. So to start, you're going to have your powder, your liquid for mixing, your needle and syringe combination, and then if you're told to give it subcutaneous, you'll have a little needle that you're going to switch it to before you give it. So to start, you'll take the caps off of your powder and your liquid, and you will take your syringe and needle out. And we typically tell you to mix it with 1 cc. So you're going to put 1 cc of air in the syringe first. And then before you do any of the mixing, you always want to alcohol the top of your vials for safety. You'll pull the cap off, And you'll put this straight into the circle in the middle of the liquid, push the air in, turn it upside down, invert it, and then you're going to pull back till you have 1 cc of liquid. Now, if you can see the needle in the liquid, then you know you're in the right spot. So pull back on the needle until you can see that tip in the liquid. If you go too far, that's good. You're just going to push the extra air back into the vial until you're at the 1. Reinvert, take it out. Now this liquid is going to go into the powder. Push it all in. Pull your needle out. And to recap, you're going to want to just slide the needle into the cap on the counter. That's the safest way, so you don't poke yourself. This liquid is no longer needed. This is your gold. This is what you're going to give. So just swirl it around a little until it's mixed. You want it to be clear again. And then you're going to do the same thing. You're going to put 1 cc of air in your syringe, put the needle in, invert it, and pull back until the tip is as low as you can get it. So you can pull all of that liquid into the syringe. Push the air in and pull the liquid back into the syringe. Get as much as you can. And if you have a large bubble at the bottom, you can flick it to the surface. And you want to push the air out. Now, if you're giving this intramuscularly, then you're going to want a friend to give it. And this is the site, either the left or the right hip, where these X's are. If you're going to give it subcutaneous, you're going to need to switch the needle. So if it's IM, you're ready to give it. And we'll go through that, and then we'll show you how to do the sub-Q shot. So the IM shot, you're going to have your friend or your partner give you a good pinch in the hip, and you want to pinch super hard because that's going to trick the skin into not feeling the poke. So just pinch real hard, poke straight in, all the way to the hub, let go, inject the medication, wait 3 seconds, pull out, and hold firmly on the skin surface. That's going to stop the bleeding and the medicine from leaking out. After about 30 seconds, check the site. If it's bleeding or leaking medicine, keep holding it until it's dry, and then you're done. To give a subcutaneous shot, you're going to need, I wasn't recapping that correctly. So slide it on the counter, recap, twist it off, and then you're going to get your subcutaneous needle. It's a little 1/2-inch needle. Twist that on. Take the cap off. And then this shot is given in the abdomen. You can pick a spot anywhere you'd like as long as there's no bruise. You want to stay about 1 inch away from the belly button. Squeeze, inject straight in, let go of the squeeze, and inject. Inject the whole medication, wait 3 seconds, pull out, and hold. If after 3 seconds, no bleeding or medicine leaking out, you're done. This will go in the sharps container along with all of your other glass. All done.
What's the difference between Hcg, Novoril, Pregnol, and then Ovidril, which is another trigger shot? And so I can answer that. Hcg can come in Novoril or Pregnol. Those are the 2 brand names. They are just made by different manufacturers, but they're technically the same thing. They are urinary extracts that are purified. Now, Ovidril is a recombinant Hcg, and it is just made differently, but your body responds the same way to Ovidril as it does to Pregnol or Novoril, so they work the same way. It's important to know that Ovidril is about the equivalent of 5,000 or 6,000 units of Novoril or Pregnol. So good to know, but doesn't mean that you really have to keep track of that. Your provider knows that already and will tell you which trigger shot they want you to take.
Perfect. Well, that's the fun part of doing something on the internet, right? Hopefully
Right.
it's coming through okay now, or at least you can hear me at home, and I do apologize. All right, perfect. Let's see. I'll try to get through some of the questions coming through before, so you can answer them, and we'll deal with my internet connection later. How do you determine the actual time frame that, so this is like a question for you, I guess. So how do you as the nurse determine the actual time frame that I would need to inject my HCG? That's a great question.
Very good question. Okay. So most medications aren't particularly time sensitive. We like you to be consistent with the time, but not exact. However, HCG is something that does need to be given at the exact time that you're told to give it by your clinic. And the reason for that is that the purpose of the HCG is to trigger the final maturation of the eggs. And if you can imagine, several fluid-filled sacs might look like a cluster of grapes in a way. Your ovary is got a bunch of these fluid-filled sacs, and each sac has a microscopic egg that's stuck on the inner wall. So the HCG, the purpose of that is to loosen the egg from the inner follicle wall so that it is free-floating in the fluid. So when the doctor does the egg retrieval and a needle goes into each one of those sacs, the fluid is aspirated and the egg travels along with the fluid down the tubing and into the test tube, and the test tubes can be handed over to the embryology lab and you have successful egg retrieval. This process, this final maturation process, takes about 36 hours. So as an example, if you're having your egg retrieval at 8 a.m. on a Friday morning, your clinic will most likely tell you to take your trigger shot at approximately 8 p.m. on Wednesday night, 36 hours prior to the egg retrieval. Now, the reason it's so time sensitive is that if you take it too early, too much time has passed if you take it too early, and your eggs may ovulate. They may be released into the pelvic cavity and we can't retrieve them. If you take the HCG too late, and not enough time has passed, then the eggs would still be stuck on the inner follicle wall and they wouldn't be in the fluid where we could retrieve them. So again, not a successful egg retrieval. So as you can tell, the timing is super important. Just follow the time that your clinic tells you to take it.
Perfect. Thank you so much. I think it's an interesting question just because people always are wondering about the time sensitivity and why it's so important. And then also, obviously, it's a great question to be able to ask, like, how do you figure out that exact time? And by extension, allows people to really understand why that timing is so important. So thank you for really answering kind of all of that in one question and really letting people know, take it seriously when your nurse tells you a specific time. There's a reason why they don't give you an exact, like an exact time for all the rest of your products. And then for this one, they give it down to very specific time period. So thank you so much, Laurel, for that, answering that question. Let's see. So this one is one that I know you have answered before, and it does come up periodically on here, but just wondering about the idea of bubbles in your injection. So the question is, are the bubbles in my vial dangerous? Is it something that I should be worried about? Do I need to get rid of them before I inject? And if so, how would I do so?
Okay, good question. I know you hear about bubbles in movies and that they can be very dangerous. When you're giving an intramuscular or a subcutaneous shot, a few little bubbles are not going to harm you in any way. You do want to tap the bubbles to the surface and get rid of the majority of air before you give the shot, just because if you have air, it can sting more. So just get rid of the larger bubbles and ignore the smaller ones, and you'll be just fine.
Perfect. I can imagine that everyone who was thinking that question now feels much better knowing that it's more of an issue of stinging than it is what you've probably seen in movies that lead you to believe that it's some, very traumatic potential outcome. So good to know that it's more just about making the process of injection just easier and smoother and more comfortable. So thank you so much for that, Laurel. I appreciate it. And with that being said, it does look like we have wrapped up our questions so far right now for HCG. So I'm going to keep checking. Let's give again another 30 seconds as we always do. Now's the perfect time to say it's open up to any product. So any one of the 3 products that we've discussed tonight, or if you just have a general question about your fertility journey that you want to ask Laurel, now's a great time to do that before we get ready to wrap up for the evening. So back over to you, Laurel, and I'll let you know if anything else comes through before we get ready to start saying goodnight to everybody.
Okay. So just a little helpful hint about HCG. It's a good idea to set your cell phone alarm for about 10 minutes before it's time to take your shot. So you have time to prepare it and get yourself ready, and then give that shot within 5 minutes of your time. And if for some reason, and this happens because we're human and sometimes we make mistakes, if you take your shot too late or you accidentally take it too early, all is not lost. Just make sure that you call your clinic immediately and you tell them the time you took it so they can make adjustments. And typically they may not need to make any adjustments to your egg retrieval time. However, they may, depending on how many minutes or hours off you are. But if you do take that shot at a different time, you just connect with your clinic and see if there's anything that needs to be done to adjust for that. And don't worry, because you're not the first person that's done that either. I just want to thank everyone for your time tonight. Thank you for joining us. Want to remind you that this program, along with all the other learning, the video programs that we do every week, are all available at mymandelsPharmacy.com. And you can access those at any time. You can also access individual videos. So if you, say, are taking Menopur and you want to watch the Menopur video, you just go to mymandelsPharmacy.com and you can find individual videos, and you don't have to go through the whole program to watch it. So you can go to their Facebook page and their YouTube page as well. They're all available. If you want to go to YouTube, you can just put in my name and the name of the medication. I've done several different videos and you can watch those. So hopefully my goal was reached, and that you feel a little bit more comfortable with giving your shots. And just know that after a few practice shots, you will feel like a pro. So thanks for joining me, and see you later.